So obviously, Dr. Russak, I've known you for a while now. You have one of the most beautiful offices, I think, here in Manhattan. Can you tell me a little bit more about your vision of launching Russak Dermatology?
Well, good morning, everyone. My name is Dr. Julie Russak. I'm a board-certified dermatologist, and now I'm starting to change and say that I'm board-certified regenerative dermatologist, because that's really where the practice is going. Overall, our medicine is going towards regeneration. For a very long time, when people heard the word aesthetic or cosmetic dermatologist, we really thought about two things: injections of neuromodulators, muscle relaxants, Botox, Dysport, Xeamine, everything that we have right now on the market, and fillers. And even the word filler, I always talk to my patients when it came, the word filler means fill something. That's what we thought in the past, that we can fill the lines that we saw as a sign of aging, and we're all going to be young forever. Long story forward, and we have the whole generation of women looking like chipmunks. We mask the signs of aging with using fillers. And I'm not saying that we don't use fillers. It's just that our understanding what we can do right now with aesthetic medicine is very, very different. And that's where regeneration comes. We know what's happening with our cells internally now as we age. So instead of us just masking the signs of aging, we can actually try to regenerate.
For those watching who are not familiar with radiofrequency microneedling technology, can you explain what it is and specifically why the Pixel8 was a great fit for your practice?
So microneedling radiofrequency right now is really the latest that we have to offer our patients. It's a collagen stimulation that really, what I explain to my patient, does kind of a sandwich stimulation. It allows us to do collagen stimulation with microneedling from the surface. But then the radiofrequency component is what stimulates collagen production in the deeper dermal layers, so you end up with a skin tightening. And that's what we are going after right now. It's a skin tightening, addressing skin laxity, since that's at the forefront of how we understand the signs of aging that appear on the face. Not necessarily just a loss of volume, but being able to address collagen degradation and collagen reduction as we age.
When did you first hear about Rohrer Aesthetics and the Pixel8?
So those are two different questions, because I've heard about Rohrer and I worked with Rohrer for a very, very long time. It's one of the first devices that I've got in the practice. Being an owner of medical dermatology, but also medical spa, I wanted something that gives me, again, the flexibility of using it on a broad range of patients, and also a device that can allow me to achieve a lot of different results. And that's where the Rohrer came in. Pixel8 has been a recent introduction into my practice. As I said, that moving towards regenerative medicine, understanding the regenerative science or the development in the regenerative science, using fractional microneedling is really a great addition to the practice. And knowing that there is a backing of great science, there's a backing of great company behind it, it was a no-brainer.
As we know, there are quite a number of radiofrequency devices available on the market. Is this the first time you've purchased a radiofrequency device?
I've had radiofrequency device for many years, but as the technology evolves and we wanted to deliver stronger results and better results to our patients, I was looking for a device that definitely is more powerful, can be done in a faster time with less of downtime. So with Pixel8, we can deliver much stronger energy, 2 megahertz. We deliver it through non-insulated needles, which in the past was very worrisome because we couldn't treat all skin types. With this non-insulated needles, it shortens actually our downtime, delivers a very precise injury to the tissue through multiple layers in one treatment. And also because, as I explained before, it goes in hot, but it comes out actually without any heat, I can treat any skin types. So it delivers it also through a broad range of patient population without worried about post-inflammatory hyperpigmentation.
Obviously, there are a lot of devices to consider when you're bringing in a new device into your practice. Can you talk about a little bit about the criteria that you look at when you're bringing in a new device into your practice?
So one of the things that you always have to look at, whether it's going to fit your patient demographic. And the great thing about Pixel8 is that it could really treat any skin type from 1 to 6. It goes in hot, and when it comes out, the heat is reduced, so I'm not worried about hyperpigmentation. And with any energy device, that's one of the biggest concerns for anybody. It's this post-inflammatory hyperpigmentation. So it allows me to really treat very, very broad range of patients that are in my practice.
What was one of your biggest concerns when you were considering purchasing the Pixel8?
The biggest concern of anybody who owns a practice but also wants to deliver results to their patients as a doctor is that it will deliver results. We want to deliver results, but at the same time, we want to make sure that it's safe, that it's a device that is going to continue working in the practice, that it's easy to use, and is reliable.
What are your patients saying about the discomfort with the Pixel8? And can you share some insight as to how you're able to mitigate that discomfort as well?
Well, we do know that it's not walk in the park. Patients feel it. It's not very comfortable overall. But compared to the earlier radiofrequency devices where a lot of the procedures had to be done really when the patients were under anesthesia, so they were mostly done when they were undergoing a facelift or anything like that. The fact that we can do it under just local topical anesthesia, and we put it in combination very often with Pronax, with gas to make the patient comfortable, I think that's a huge step forward. The biggest, I think, advantage of Pixel8 is that it's fast. Having something that is that powerful, 2 megahertz, but you could do just several passes, so the patient doesn't feel that built-in heat, because that's what really is uncomfortable for them. When they're laying there for hours and there are multiple passes that needs to be done to deliver the right amount of energy, we mitigated that with just quick 1 or 2 passes. And they feel much more comfortable at the end of that.
And how many treatments are you doing per day or per week?
Now that we have this technology, I would say that we do probably around 4 to 5 treatments a day.
Can you talk about some of the results that you're seeing with your patients and what's some of the feedback been like?
The results are great. The first feedback always for my patients specifically is that there's not a lot of downtime. Because everybody wants results, but nobody wants to take a week to 2 weeks, especially in Manhattan, we're all on constant running cycle. So that doesn't work for my patients. So being able to give them the results, but not give them a lot of downtime has been fantastic. It's also great because there's a lot of different areas that we treat right now. Dermatology moved on from treatment only the skin on the face. We do a lot of body treatments, and we do a lot of body treatments with Pixel8.
Obviously, one of the things that you think about when you're purchasing a new device, I'm sure, is marketing the device as well. Can you share a little bit about how you market the Pixel8 in your practice?
So we started first marketing to our existing patients, and it's always the best and the easiest marketing, because with our existing patients, they already have the understanding and the background of what we do in the practice. So adding something where we explain to them that this is the latest in our understanding what the skin needs has been very easy, and it goes well into the regimen that we create for our patients. Most of our patients, we create regimens for 6 months to a year, and Pixel8 radiofrequency microneedling just goes right into that regimen. Most of our patients are on rotational skin tightening protocols. Then there's a lot of understanding outside in social media about what radiofrequency does for the skin. So just being able to put our before and after pictures, to put our right after pictures, which are great. There's not a lot of downtime with it, and that's always a great marketing tool also, especially in New York.
If someone wanted to see how you've been marketing the Pixel8 in your practice and some of the results you've been able to achieve, where can they go to see that?
Definitely Instagram, definitely our website, and in general, just talking to all our providers.